less shortness of breath, less pain, while quality of life improves. Heart failure is the condition that CoQ10 gained its reputation on. And then doctors decide, well, let's try it for some other things too. So CoQ10 is big in heart failure. Next, hypertension. Multiple double-blind placebo-controlled trials show that CoQ10 reduces systolic pressure by about 11 points and diastolic by about 7 points. There's a chance that you won't need your blood pressure pills anymore if you take CoQ10. That remains to be seen. You have to find out. But wouldn't you rather take a nutrient than a medicine to control blood pressure? I absolutely would. Don't forget your vitamin D with that. That'll help too. Atherosclerosis, arterial sclerosis, hardening of the arteries, blocking of the arteries. CoQ10 softens the artery over time, and it improves that endothelial function, so the artery knows whether to open or close. It has to do both for proper function. It knows how to do it. Stress-induced cardiovascular disease. Here's a study. CoQ10, when combined with garlic, reduced stress-induced cardiovascular disease by 75%. Remarkable. It lowers the artery calcium, that hardening of the artery. Less inflammation and lower blood pressure. Healthy patients exercise tolerance. You're in good shape, but you want to exercise more. Maybe you're a young person. Maybe you are a senior and you want to plant a garden this year. You want to be a little more active. If you take the CoQ10 before you do it, no heart disease, you will perform better and you'll recover quicker after that strenuous activity is over. That's a true benefit. Healthy patients taking a statin drug for cholesterol. Statin drugs inhibit the manufacture of CoQ10 just like it does cholesterol. And we have a nation of depleted CoQ10 patients who they're taking these statin drugs to lower cholesterol. So multiple studies have shown if you supplement CoQ10 with your statin drugs, you can compensate for that and you're not less susceptible. You know, I've often wondered if statin drugs did not lower CoQ10, how much better they would be in the prevention of heart disease. I think it would be a dramatically better drug if they could figure out how to not lower CoQ10 with it. But until they do that, please take a CoQ10 supplement when you're taking Lipitor, Zocor, in any order with that. Please do that. You will benefit from it. Cholesterol, CoQ10 lowers LDL and it raises HDL by about 3%. It's enough that it's significant. It's not a large amount, but it's helpful. Diabetes. CoQ10 lowers oxidative stress and inflammation. It reduces blood pressure. It prevents elevated insulin levels. This insulin resistance of type 2 diabetes helps to reduce that. It improves artery and nerve function because all cells need CoQ10. That's how all cells get their energy to do its various functions. You know, one of the things cells do with CoQ10 is drive the feeding mechanism. And this is what we see fail first. The nerves and diabetes. It can't heal from the daily insults of high sugar levels and whatnot, and you get the diabetic neuropathy. So fuel the healing mechanism, the detoxification mechanisms in our cells. We do that with CoQ10. It provides energy for all the cellular functions. That's important to understand. To help you understand the benefits of CoQ10. The brain and the nerves also benefit. CoQ10 protects the brain. It activates neural stem cells. We can replace brain cells, but it's a very slow process, just like replacing heart cells. CoQ10, they found, activates the neural stem cells to help replace anything you lose from tiny little infarcts. This is a common part of aging. It's a reason why we lose our ability to think with age. And we replace those brain cells, we're far ahead with that problem. It reduces slowing the progress of Alzheimer's disease and slows the progress of Parkinson's and other neurodegenerative disease. Now, it doesn't cure them. I'm not saying that. But anything that we can do to slow it down, add your curcumin with that, your fish oil, vitamin E, vitamin C. You're going to take steps to keep your brain sharp. CoQ10 is instrumental in that entire process. Eyes and ears reduces the damage of glaucoma, slows cataract formation, even protects and reverses noise hearing loss. You know, maybe you're a carpenter. Get on the CoQ10, curcumin, and other nutrients for the ears, for the nerves, like alpha-lipoic acid, B12, and zinc, this type of thing. And you can restore some of it. Miscellaneous. Combined with the Mediterranean diet, CoQ10 lowers inflammation, improves bladder function and prostate enlargement, lowers the PSA in healthy individuals, protects the diabetic kidney, helps to improve male fertility, improves saliva flow, and the dry mouth, dry eye syndrome called Sjögren's syndrome. That's really important. If you've never struggled with dry eyes and dry mouth, you have no idea the disability it creates for you. CoQ10 helps to improve that. When combined with curcumin, CoQ10 with curcumin, it stops bone loss. Plays a role. See, all cells need CoQ10 for metabolism. This is amazing. So it has a role in osteoporosis. Side effects? None. Unless you take huge doses, and none of you need that level of dose. Folks, we have a break. When we return, we're going to talk about L-carnitine, the helper to CoQ10.
May Savings Time is here again with our annual Cancer-Free Celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioRenovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's Bionutrients and Noni Natural Skincare are up to 50% off. Aloha Noni and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega-369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings. We're back, everyone, having a great discussion on CoQ10 and a healthy heart. This is just amazing information. But before we continue, I want to let you know about the May Savings Celebration at BioInnovations. Great prices, best prices of the season, and free shipping on orders over $50 in the mainland USA. So this is a good time to get the CoQ10 and that Heart Smart plan so you can have a healthy heart. So, Richard, before we go on to L-carnitine, let's let everyone know quickly how you take CoQ10 and what the milligram dosage that they should look for.
You will find doses of CoQ10 as low as 5 milligrams a day, all the way up to 1,200. 5 is so small that it probably wouldn't help the majority who are truly in need of CoQ10 supplementation. It can take up to 2 weeks to get your CoQ10 level up to where it's helpful. So I would recommend a higher dose, 90 milligrams, maybe even 200, 300 for a few days to get your blood level up, and then reduce it to the least amount to give you the benefits you need, because we want this to be cost effective. Also, the reduced form of CoQ10 works better, it absorbs better. And certain preparations, such as ours, you absorb up to 300% more of it, which, it just makes it more cost effective. That way, a 30 milligram gel cap is enough. It equals a 90 of somebody else's. This is what it's got to get into your system. The reduced form and the formulas that absorb very well, that's what you want. It keeps the cost down in the long run. Now, let's talk about L-carnitine. We come to understand that CoQ10 helps to turn glucose into cellular energy, ATP. And L-carnitine is an amino acid that turns fatty acids, the lipids in the oils in our diet, into ATP energy for the heart. So you have this synergy. CoQ10, the glucose, L-carnitine, the fatty acids. And this is important because 60% of the cardiovascular energy demand comes from, it's supplied by fatty acids. And I always worry about people who have slightly elevated triglyceride levels. That's what we're talking about. And they're doing all these desperate steps to drive it way down to under 100. Don't do that because your heart needs that for energy. The majority of the energy supplied to the heart comes from these triglycerides. If it's too low, you're going to starve your heart. It's not a good thing to do. So L-carnitine improves that energy flow from the triglycerides. Myocardial infarction. What happens when we add L-carnitine to our supplement plan? Myocardial infarctions, it reduces mortality from a heart attack. It reduces the infarct size. It's not as big of a heart attack. It improves the ejection fraction again. Again, when the heart has the energy it needs, even if it's been struck with a disease, it's going to perform better when it has its energy. This makes sense. You're less likely to suffer a second heart attack. You'll have less chest pain, fewer arrhythmias of the heart, better exercise tolerance, and lower heart failure, decompensation, and complications. So it improves just like, and you're getting not only the glucose pathway, but also the triglyceride pathway. What about atherosclerosis? This is the one condition, claudication, that brought L-carnitine to the forefront. CoQ10, it's heart failure. L-carnitine, it's claudication. In other words, what this is, you have stricture in, for example, your leg arteries. And so as you walk to the grocery store, your car, or whatever, you can't keep up with the demand in your heart, can't get the blood flow to your legs, and it starts to scream ischemia. Same thing that happens in the heart with angina, but it's happening in your legs. It's called claudication. They've been able to show that if you take the L-carnitine in claudication, your walking distance, free of pain, increases anywhere from 23 meters to 123 meters. This is dramatic. This is back to the mailbox and back. This is what I'm looking for. Even if I get a close spot at the grocery store, I can get in and get things now, where I couldn't do that before. And the maximum walking distance before you just say, I've had enough, I can't do any more, increases anywhere from 9 to 100 meters more. That's 100 meters. That's 100 meters. That's like 108 yards. Just think yards. This is enough to improve quality of life. In heart failure, the same thing, improves walking distance. Your cholesterol and triglyceride levels. Since the triglycerides were augmenting their flow into the heart for energy, when we take L-carnitine, if you have high triglyceride levels, it'll help to bring it down. This is a better way to manage triglycerides than drugs. And we need those oils in our diet. The olive oil and all these things, these are good for us. So it really helps with our cholesterol and lipid management. And one of the new findings is L-carnitine really helps to lower LPA, lipoprotein A levels. It is the most accurate predictor of heart attack. It's not the cholesterol, it's not the LDL, it's the LPA is the most accurate predictor. The higher that LPA, the more likely you're to have a heart attack. And L-carnitine lowers LPA. This is tremendous without side effects. Dialysis patients. L-carnitine with CoQ10 lowers the LPA in dialysis. Dialysis patients, renal dialysis, are very susceptible to increased heart attack risk. CoQ10 and L-carnitine will help the renal dialysis patients. Multiple studies. It lowers the inflammatory profile in the kidney, and it lowers the oxidant stress, the free radicals in the kidney, which is a real problem in renal dialysis, chronic kidney disease. Diabetes improves glucose tolerance. We talked about that. Asthma deficiency is common in asthmatic children. Replacing it improves asthma scores. Autism, there's some benefit for the autism patient. Erectile dysfunction, L-carnitine, arginine, and niacin improves erectile dysfunction in almost 80% of the men who try this. I'll repeat it: L-carnitine, arginine, and niacin, vitamin B3. Arginine is an amino acid. Natural approaches to erectile dysfunction. Aging. Double-blind study of 66 100-year-olds, reduced, 100-year-olds. Give them L-carnitine and reduce total fat mass, increased muscle mass, increased the capacity for physical and cognitive activity by reducing fatigue. It helps even elderly people who just don't feel well or they want to do a little better. So, the point of this, it's never too late. It's never too late. Doses anywhere from 250 to 2,500 milligrams a day. If you're on seizure medicine, you'll need more because you clear out more L-carnitine now. It complements CoQ10 beautifully. Let's go to our break. When we return, let's talk about D-ribose. This is a sugar that we don't use to raise our blood glucose, so it's safe for everyone to take, but we make ATP out of it. We'll have that when we return. CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's BioNutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Here is our hope for you today. I'm Cindy Becker. Do you feel that you'll never really be joyful and happy in your life? The Reverend Billy Graham wrote about these two emotions, joy and happiness. Dr. Graham says, joy is not the same as happiness, although they may overlap. Happiness depends on circumstances. Joy depends on God. In Psalm 30, David, whose life seemed in this battle, experienced joy despite his problems as king of Israel. David wrote, "You turned my wailing into dancing. You removed my sackcloth and clothed me with joy, that my heart may sing to you and not be silent." If you are struggling to find joy in your life, pray to God. Count your blessings. Joy depends on God. I'm Cindy Becker. This is our hope for you today. May Savings Time is here again with our annual cancer-free celebration.
Cindy and I would like to thank you for your continued support of our efforts here at Your Health Television and at BioInnovations.
We understand you must be very careful with your budget, so we're offering you the best prices of the year on many of your favorite supplements for the entire month of May. And shipping is free on all orders over $50 in the continental U.S.
Perhaps you've heard about many of these supplements and wondered if they'd help you. Now's a great time to give them a try.
Dr. Becker's BioNutrients and Noni Natural Skincare are up to 50% off. Aloha, Noni, and Acai are still half price by the case. And many other products you've grown to trust are up to 30% off.
May is a great time to stock up on your favorites.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. everyone, just a quick reminder before we go on with our talk. It is May Savings Celebration at Bioinnovations. Great prices. I mean, really great prices. Good celebration we're having. And free shipping on orders over $50 in the mainland U.S., so don't miss it. So, Richard, this is interesting. We did a lot on CoQ10 L-carnitine, and we have a good understanding of that now. So now to move on into the HeartSmart plan, let's talk about D-ribose.
D-ribose is a 5-carbon sugar. Glucose is a 6, so it's a little different. That becomes part of the ATP molecule. The addition of this 5-carbon sugar, this D-ribose, to ATP is one of the rate-limiting steps to the production of ATP. What I mean by that is you can have all the L-carnitine you need. You can have all the CoQ10 you need. Everything there is fine, but if you don't have enough D-ribose, you're still going to be compromised on your ATP because it's one of the rate-limiting steps of this production. So adding a little of this D-ribose to your plan complements L-carnitine and CoQ10. Multiple studies show improvements in fatigue, shortness of breath, chest pain, and exercise tolerance when taken alone, but it works best if we complement the CoQ10 and L-carnitine. Now, please understand, if you take a scoop of D-ribose and put it in your mouth, you go, oh, that's sugar, that tastes sweet. And, oh, I'm a diabetic, I can't have that. D-ribose does not raise blood sugar levels. It's so special, the body dedicates it to the production of ATP, not to raising your glucose level. So this is a substance, say you like a little sweet in your iced tea or your coffee or whatnot, but you got to stay away from the sugar and you don't want those artificial sweeteners. Put a scoop of D-ribose in there. It will be sweet, it won't raise your blood sugar, and it will help your body make